Dr. Salem, Doctor of Physical Therapy from Brooklyn, New York, with a live case from my clinic. What I do for my patients some education, health education, and it's good to share this education with you guys. Okay, see here, my brother. This is a small joints. It's called facet joints. You can see them. Yeah. Those are joints that has some degeneration. It's called wear and tear, like the car tire when you use it for a little bit, long time. It's not like the new one. There is some wear in there. There's a wear and tear. This is small joints here, and it's called a DJD, degenerative joint disease. Usually, degenerative joint disease is called when there's narrowing of the joint space. Like if the joint space was big, is a sign of, it's a good sign. There's no DJD. When the joint space is very narrow, it's called a DJD. And also with the hypertrophy, meaning increased in a bony size, the bones become a little bigger, okay? This is what causes DJD. How the bone becomes a little bigger or hypertrophied? Okay, there is always recycling in our bones. There's always cells that destruct the bones, and there is always cell that is building, demolishing and building to recycle. But there's some borders, they envelop, some sheath, lining to prevent the cells that build bones to build outside of that membrane. When there's some wear in the bone, some wear and tear, then that lining with that sheath that envelop, that limits, draw the borders for the bone surfaces is being worn. You know what I mean? It's not there. So sometimes the cells build up some bones outside the surfaces. You know what I mean? That create extra bones because this is like will be the wear and tear, will be rough surfaces in here. These are joints, so we're gonna work on that, don't worry. Okay. Those joints become a little bit narrowed, and there's a little bit narrowing in the joint space. This is the vertebrae. This is S1, this L5, this L4, and there's some disc here, the disc between S1, L5. Sometimes there's a narrowing between disc space here. Okay, this we can open it. How we use the leg? This is the leg come from here. I bend the knee, so the thigh bone will be parallel to your spine here, and I push that femur down, and I take this level up and push this down, so I'm gonna open this space like this. And at the same time, I can open this joint same way with my hand. I push the leg. When you push the leg down, imagine this young boy here. If I push this leg here, if I take this, imagine this living person, but this has all nails, okay? I push this way, so I'm gonna take this bone and build this down. And if I put my finger here, I open this up. Because I'm pushing this down with my hand here, this pushes down, and this push up, you got me? Does it make sense? Yeah. Also, I can do for the joints here. This guy is nailed up. I'm gonna show it here, the same. If you push this down, and I push this up, you open it. And here is the nerve extent. The nerve come out from here, this way, and when you open this space, see the nerve, there's no touch. The pain happens when the nerve and disc touch each other. Or when there's narrowing of the foramen, where the nerve come out, like either by the joint, facet joints narrowing, or by the disc space narrowing. But we open both, and sometimes we move the disc away from the nerve, and even the nerve is movable. So we can move the nerve away from the disc by moving your leg away, okay? I'm gonna teach you all the stuff that's gonna help you how to open disc space, how to move the nerve away from the pain, so the pain will go away. These are the issues you have. There's something more important that we need to take care of. Okay, look here. They see the ribs. There's a bone here for the pelvis. The 11th rib, there's a 12th rib, which is not full rib, just like that. If you put your finger here, is enough for 4 fingers between this and this. Okay, my brother? Okay. What happened? We have muscles, so many muscles, not one, but so many muscles. One of them is called the QL muscle. QL, quadratus lumborum muscle. It's the muscle the belly dancers use to dance like this, okay? This muscle. So this muscle comes from here to here. And when the muscle spasms, it contracts. So take this, make this one and this one close together. Sometimes it's close to 3 finger or 2 finger, 1 finger. Some people will be like no space at all. Okay. Why? Because this muscle has come from here, it has attachment here, attachment here, attachment here. But those muscles are interlaced. Interlaced means that doing the traveling from their origin to their insertions between their attachments to do their work, because muscles move the bones on each other. The other muscles that meet and attach like this. So if one is going to spasm, pull the other with it.
Oh, I see.
One going to spasm, keep pulling the other way, because all body is connected, all body attached. All body is one unit and one machine and one device. Okay, but although we have systems, but all connected and all, you know, إذا اشتكى منه عضو تداعى له سائر الأعضاء بالسهر والهون. So we have the diaphragm. Diaphragm also has attachment in the ribs here, attachment in the ribs here, attachment here, attachment here. So this muscle would also either pull the diaphragm or diaphragm pull it. One of them is spasms, pull the other. Okay, that's why they have diaphragm spasm here, tenderness in the diaphragm. They have pain here between the ribs, because those are ribs. Diaphragm attached to them are not functioning properly. Okay, why this important? Because when there's no space, no enough space here, will be this compressed. The spine becomes shortened. Will be not enough space for the discs, not enough space for the nerves getting here. That's why very important to relax the muscles, so you can open the space here. And when this muscle relax, you have more space here. Now you can have more space for the discs, more space for the joints. You got me? So no conversion nerve is not gonna. This is what you have. There's another muscle that you have some rotation in your spine this way. It's some muscle that arises from here, from those sides of the trunk. This is a lumbar spine, and you, as we said before many times, the lumbar spine has posterior aspect and has also anterior aspect. If we examine the back patient, or examine the back, we need to examine the back of the back, the posterior aspect of the spine, and as well as the anterior aspect of the spine. One very important muscle comes from the side of the, it's called the transverse processes of the lumbar spine from the right, go down here, attach to the leg, touches actually here to this area. And this muscle flex here, the leg like that, take it out, and this side as well. If this muscle is spasms one side more than other, so it's going to rotate the spine like that.
Oh, I see.
Which what you have. And this muscle causes pain in there.
And this is my case, right?
You have all these your cases, unfortunately. I did some video before about how the viscera and organs affect your body, and I'm going to refer you to that YouTube channel. You can go to the video small intestine and back pain. Okay, this is Dr. Salem from Brooklyn, New York. If it's your first time to watch me, subscribe, press like if you like the video, leave your comments or question below, and share it with friends. So many people need the information, so pass it around, and bye now.